Your Excellency Chief Olusegun Obasanjo, former President of the Federal Republic of Nigeria and Grand Patron of the African Congress on Sickle Cell Disease, Honorable Dr. Osarik Ehanire, Federal Minister of Health Nigeria, distinguished guests. It's a great pleasure to join you for the Second African Congress on Sickle Cell Disease. This event is testament to the growing momentum around this long-overlooked global health issue, which predominantly affects people in sub-Saharan Africa. In some African countries, it's estimated that 1 in every 100 newborns has sickle cell, and that it causes up to 15% of deaths in children younger than 5 years. People suffering from sickle cell disease experience debilitating pain crises. They find it difficult to do routine activities like attending school or walking long distances, and they are more susceptible to infections. The costs of this condition are enormous, particularly for low-income households paying to bring children to health facilities several times a month to manage pain and treat infections like pneumonia and diarrhea. Simple, highly effective interventions such as newborn screening and prompt treatment exist. Malaria chemoprophylaxis, vaccination against other diseases, adequate nutrition, and hydroxyurea have been shown to reduce the frequency of pain crises from every couple of weeks to every few years. But for too many people with sickle cell, these solutions are out of reach. Together, we need to raise awareness of the ways that people with sickle cell can enhance their quality of life, including by getting routine vaccinations and avoiding triggers such as strenuous exercise and the use of tobacco and alcohol. The Global Coalition on Sickle Cell Disease is being established, and we hope that you will all join it. We're presently calling for more stakeholders from the African continent to join this global movement, from civil society, the private sector, and governments. The creation of an African coalition would further enhance and unify our collective efforts. In the health technology sector, there is a lot of buzz around research into medicines and diagnostics for this condition, with encouraging outcomes in therapeutic reactivation of fetal hemoglobin, hematopoietic stem cell transplantation, gene therapy, and genomics. Investment is now needed for new and proven interventions to be integrated into health systems. As WHO, we're working with dedicated treatment centers in Benin, Mali, and the Republic of the Congo to build clinical care capacities. We are emphasizing in all countries that care for sickle cell disease needs to be available as part of primary health care and integrated with programs on malaria, HIV, as well as maternal and child care. Referral pathways to higher levels of care should also be clearly defined and streamlined. In closing, I ask that we all make the most of the opportunity of this moment and this Congress to mobilize communities, networks, and funding for stronger partnerships to save children's lives and improve well-being for people suffering from sickle cell disease. Thank you very much.